and thank you for having me. This is very exciting for us to be a part of something like this. I'm going to keep it simple. I'm just going to tell you 4 stories. One case study that we dealt with for each of the 4 areas that we've divided these social determinants into. And each of the 4 stories that I'm going to tell you has a different financing structure and different pros and cons and lessons to learn. The first one, actually, I first heard about a year ago when I was talking to a professor at USC who's an environmental expert. And he had been called over to China to consult on the environmental issues they were having in Beijing. And he sat through the first day of meetings in a workshop like this one, and they didn't ask for his input at all. And he was surprised because he had been told that they wanted to hear some lessons from the United States. So at the end of the day, he called over the person who had invited him, and he said, what would you like me to contribute to this? It's really unclear. And the person said, we only want one thing from you. We want to know how Los Angeles cleaned up its air over the last 30 or 40 years, how it got rid of a lot of the smog. And he said that was very revealing. Now, it was interesting for 2 reasons. The first was that solution that Los Angeles put in place was a very command and control solution. It was very top-down, government regulated. It is likely something that we would have a difficult time putting in place in the United States today, but that was the only thing that China cared about. They wanted to do a top-down solution. That was interesting. The other thing that was interesting was I was surprised. I said to him, are the 2 cases really comparable? Because my understanding is that Beijing, I mean, some days the sky is brown. Was Los Angeles ever really that bad? That doesn't seem right. And he said to me, wow, you really are young, aren't you? And I like that story because there are a lot of stories like that of public policy successes that we've either forgotten or haven't been passed down to the next generation. And when I started looking into this particular one, it was amazing to me how much success we did have in cleaning up the air in Los Angeles. So very briefly, what happened in that situation is that back in the 70s, there were 200 days a year when the air, the particulates in the air, exceeded healthy levels. And there were dozens of days a year when it was at emergency levels. There were certain hours when they would have students not be able to go out and play recess because the air had reached such a level during that peak hour. That doesn't happen anymore. And what happened was 2 things, one at the state level and one at the federal level. At the state level, Governor Ronald Reagan created an air regulation board, right, that was designed to try to fix this problem. The problem was, for the first few years that this board existed, it didn't really have much of an effect. And part of the reason was because it didn't have a lot of the legal authority that it needed. Part of it was because it didn't have the political backing. So on that poll, you voted for political will, and that certainly matters. But one of the questions you have to ask is the political will of whom? Oftentimes you have policymakers at one level of government that are very much in favor of something, but policymakers at another level are completely unaware or unwilling. And so in the 1970s, when Richard Nixon signed the Clean Air Act, that was what gave the regulatory board the legal authority and, in fact, instructed them to regulate particulates in the air. Specifically, they required cars to have catalytic converters. They instituted some regulations that pushed the power plants into burning cleaner natural gas, things like that. It's an interesting solution because it is, as I've said, not something that might be as favored today. And so in thinking about that example, it's something that we have to remember that we operate within a policy context. The context in the 1970s was very different from the context today. but it was dramatically successful. We have researchers at USC in the School of Medicine who have measured the pollution levels in the air in Los Angeles over the decades and found that they have dropped significantly. And the stories you hear about the smog being so bad that you couldn't see from one building to the next, living in Los Angeles, I can tell you that you can see much further than that nowadays. So I may be young, but I can recognize that. The second story that I want to tell you is about the home, about housing. Housing is actually the area where we spend probably the most amount of our researching time. And it's surprising how many people do not think about housing as being related to health. But if you mention it to people, they really do get it. I was in an Uber coming in from the airport just last night, and I mentioned something about it, and the Uber driver went off for 10 minutes about mold in homes and lead in pipes and how upset she was with what had happened in Flint, Michigan. And so that's the type of thing we're talking about when we're talking about healthy homes. And so people really do understand that everything you breathe in whatever room you're sitting in, everything you drink that comes through whatever pipes you're getting your water from, that those things matter. In this situation, the example that we thought about as one of the more successful interventions was very much not top-down. This was, again, a collaboration between federal and state, but in this situation, we're thinking about when the Department of Housing and Urban Development created its Healthy Homes initiative that gave federal grants, essentially, to state and local governments to create their own programs to reduce, mostly to reduce lead in homes, lead exposure, but they've also given grants to reduce mold and other things like that. This is perhaps an example that is more suited to the political environment at the moment. There is support in Congress for these types of grants, more so than a more top-down approach. So when we think about political will, one of the lessons we can learn from a story like this is that there may not be political will for the types of solutions we're thinking about, but we might have to work within the context that we're given. And in today's context, there is some political will, we think, for this kind of a solution. And so it was in the early 90s when HUD gave these grants to state and local governments. And there have been a number of studies in different cities evaluating different types of projects. And it gave states and cities the freedom to create a program that they felt that they had ownership of and that they felt would be most suited to the context of their cities. And in every case that we've looked at, these grants were successful in reducing lead exposure and making homes healthier. Now you have a downside with this, as you have a downside with everything. And the downside is, obviously, if you are in the federal government looking at the state and city governments, you don't have as much control over this. And oftentimes, these types of grants are used by legislators as a reason to give less funding, right? Because they just give a certain amount and they don't necessarily tailor it to how much is needed. So that's the downside that you have to weigh with that one. With the third category that we're thinking about, it's neighborhoods. With this one, there's a new book out this year, a wonderful book by Michael Marmot, physician who has been one of the leaders in the social determinants field. And he tells a story at the beginning of the book about how he got into this kind of research and this kind of advocacy. And the story is that he was a medical resident about 40 years ago when he was a young man. And he reached a paradox of sorts. He was treating a patient who had a heart attack. And he was able to stabilize the patient and give them some medication and send them home. And according to all medical principles, he had done his job perfectly. He'd done everything he was supposed to. But he realized that he barely did anything for this man, because he was sending the man right back to the neighborhood and the environment and the lifestyle that caused the heart attack in the first place. And he said, what kind of doctor am I? What am I really doing for this man's health if I'm just sending him right back into the fire? And I think that one speaks to neighborhood quite well, because the context in which you're living certainly informs your health a lot. Here, there's a lot of things that we can think about. We can think about crime. We can think about whether you have a walkable neighborhood, whether you get exercise, whether you have access to healthy food. Food deserts are a tremendous problem that a lot of people honestly don't know about. If I put up a map right now of Los Angeles County, a heat map, and I colored the map based on where people had access to grocery stores, there would be a gigantic hole in South Central Los Angeles where the poor, heavily minority neighborhoods are. It's a shocking map for most people when they see it for the first time, when they realize that if you live in those neighborhoods, you can't walk to a grocery store. Even though it's a fairly dense neighborhood, it's right in the middle of a city. That's a tremendous problem. So with neighborhoods, the intervention that we thought about actually addresses all of these things. It's the moving to opportunity experiment, which some of you are probably familiar with. And the reason it addresses all of these problems is because this moving to opportunity experiment gave people the opportunity to move to new neighborhoods to address whatever ills they were dealing with in their current neighborhood. And the way this one worked was that it was directed from the federal government, from HUD, and it was operated in multiple large cities. But this one was a partnership with private foundations and private consultants. And so now we have a private-public partnership that we can talk about. And the way that the Moving to Opportunity experiment worked was very simple. They went to residents of public housing in these major cities, and they broke them up into 3 groups by a lottery so that it would be a randomized experiment. And the first group didn't get anything. They were the control group. They stayed in the public housing. The second group received a voucher, a housing choice voucher, the same way that housing choice vouchers work now. They could use it wherever they could find an apartment where they could use it. And the third group got a housing choice voucher, but they were required to use it to move to a low poverty neighborhood if they wanted to use it. Because what we have seen with housing choice vouchers is one of the downsides is a lot of people may use it to move, but they may not move to the neighborhoods that we would think would be best for them. They may stay in the high poverty neighborhoods for a variety of reasons. They may feel that they have social capital built up there, connections that they can use. If they want to get a job, it's through their family and friends who can connect them to employers. If they want to leave the home and have somebody to babysit their child, they have friends to rely on. And they may not honestly know about all the neighborhoods out there. They may be afraid to move into the low poverty neighborhoods. And there's even some research indicating that when low-income folks move into a low-poverty neighborhood, they feel more stress because now they have to live up to everyone around them, and they may be ostracized from that community. And that's difficult to come home to at the end of the day. So the Moving to Opportunity experiment wanted to weigh these different things and see how people operated if they were given the choice versus if they were required to move to a low-poverty neighborhood. And the biggest takeaways from this experiment are 2 things. One, the folks who got vouchers in both of the treatment groups, the folks who got vouchers did experience improved health, especially mental health, but there were even some physical health metrics that had improved. And those metrics may even get better over time because, as we all know with those kind of studies, your physical health improves over the long term. But the interesting thing was that it did not help in the way that people expected. And this is an interesting thing for us to think about because it improved people's health, And that's what we all care about in this room, but it's not really the first thing that was on anybody's minds when they created the experiment. They created the experiment to help people economically. And so the health was just a side benefit. And it's important for us as people who are advocating for thinking about the social determinants of health to make sure that policymakers and voters and everyone is aware that there are health implications of these economic interventions, and that they don't have to think of it only in economic terms. Because the first studies that came out from Moving to Opportunity honestly almost sounded like it was a failure, because the heads of the households, the adults who had made the choice to move, were not experiencing better economic outcomes, not significantly doing better in terms of unemployment, in terms of wages, and so on. It was only until over a decade later, when researchers went back and looked at the children of the families that had made the move, that they found out that they were doing significantly better and earning a lot more money once they became adults. And this fits with a lot of the sociological research that we've seen on neighborhoods, because for adults, it's hard to make the jump to a better income and a better occupation. For a lot of these people, their paths are already set in stone. But for children, neighborhoods have a tremendous impact on their cognitive development, on their mental health, on their ability to develop impulse control, the kind of focus and emotional intelligence that's required to succeed in the workplace. And those things don't play out until they do get into the workplace many years later. But the interesting thing from a financing perspective is that this experiment didn't happen only through the federal government. They gave these grants to the cities to, they administered them directly from the federal government to give these folks the vouchers. But they brought in private foundations to supplement that funding. They brought in private consultants so that the research would be objective. So they had a third party doing that. And even after the experiment was over, the private foundations remained in a lot of those communities and tried to continue to help a lot of those folks. And that is not something we hear quite as often, so it's an interesting example. The final example is in economics itself. And here we're thinking about how much you earn, what kind of education you have. The gap in life expectancy between the folks at the top of the income distribution and the bottom distribution is astonishing. A lot of people don't know it. For women, the difference is over 10 years of life between whether you're in the top decile or the bottom decile. The rich are living 10 years longer than the poor, and for men the gap is even wider. So that is a reason enough to think that economics certainly matters to health in a way that people often don't think about. And certainly with inequality being something that's gotten a lot of press lately, this may be an area where we actually can find a lot of support to do something about this. The intervention that we looked at here went all the way back to the beginning of your economic circumstances, to when you're a child and you receive the education that will, in a lot of ways, determine what kind of career path you wind up on and whether you're able to make it into those top deciles or not. There have been a lot of education reforms in the last 20 years or so, and the evidence has been very mixed. If you talk to education researchers, a lot of them are frustrated because they don't have a silver bullet. They can't point to one school that overwhelmingly makes people better off. But if you do ask them to point to a shining example, the one that they're probably most likely to point to is the Harlem Children's Zone, which a lot of you have probably heard of. The Harlem Children's Zone is unique in a couple of ways. The first is that it has a certain type of charter school that there aren't a lot of in the United States. It's called a no excuses charter school, and the idea is we make no excuses based on the student's background. We hold them all to a high level of expectations. And the research does show that these types of charter schools do seem to close the achievement gap in terms of students' test scores, especially in mathematics and a little bit in reading. But the thing that makes the Harlem Children's Zone unique is that they combine the charter school with community programs. So the Harlem Children's Zone has been expanding over the years. Now it is a 97-block area in Harlem, in New York City. And if you are a child who lives in those 97 blocks, regardless of whether you go to the school, you can participate in these community programs. And we're not just talking about after-school tutoring, though they have a lot of that. We're also talking about extracurricular activities. We're talking about karate. We're talking about dance classes. We're talking about college prep. We're also talking about community programs for the adults, for the parents. There are parenting programs. There is income tax help. Anything that they think might be able to help the families help the children, do a better job of helping the children. And Harlem Children's Zone has shown significant success, better than almost any other reform that we've looked at out there, in closing the achievement gap in test scores. The downside with this one is that in the long run, the results have been less clear. Similar to Moving to Opportunity, they tried to look at, well, how does it actually affect people's earnings years later after they graduate? And here the evidence is a lot more mixed. So whether this is a sustainable solution is up for debate, but we know that as far as the children are concerned at the time, they are performing much, much better. The other thing that we have to think about in terms of the institutional structure now, in terms of how we finance these sorts of things, is that Harlem Children's Zone is unique in another way. And that is that it is a typical charter school in the sense that it has the city funding, right? So it has the public backing. But this, again, is a public-private partnership. And like a lot of the high-achieving charter schools, it receives significant funds from private foundations, like the Gates Foundation and other educational reformers like that. It has an endowment of, it has assets of hundreds of millions of dollars. That spreads out to multiple schools within the zone, but even if you break it up on a per school or per pupil basis, it is far better funded than public schools or even most charter schools. So the question we have to ask is whether this actually is a scalable financing arrangement. Can we really expect that much money to go into every school in the country? Probably not. So those are just 4 simple stories that I wanted to tell you. You can see that each of them is different. We've got public-private partnerships, we've got partnerships between different levels of government, and then we've got the most top-down example that we began with. Each of them have been successful in their own way. Not all of them may be scalable, not all of them may fit into today's policy context, but they do give, I think, 4 really interesting and good examples that we all can draw upon when we're trying to convince folks to spend the money to address social determinants. We now have some good examples about where to get the money and how to tell folks that this arrangement might actually look. And now it's open for a discussion to see what you guys think of all that.